Hiya, my name is Mel. I'm the Resource Officer for the Trust, and I'm here today to introduce you to your new single bag when it comes to delivering medical emergency equipment to our patients. As you are aware, historically we used to have 3 bags, and due to constraints on the wards when it comes to storage, sometimes those bags may be stored in 2 different areas, which meant that in an emergency a member of staff would have to run and fetch 3 items from 2 areas. Now that causes complication and it could lead to patient safety issues. So we have made a decision to go to a 1-bag solution when it comes to medical emergency equipment. So we've chosen a green bag because that's the colour that we had historically, so patients and staff are aware and used to seeing green bags being brought to a scene. This bag is designed to be carried as a rucksack, so I will turn it around. If you were going to use it as a rucksack, which we do suggest because it's ergonomically the best way to carry it, you just need to lift these plastic straps out of the way. It releases the back straps and then you can obviously wear it as a rucksack. It can also be carried though as a bag from the top. And this can also be used maybe by 2 people to carry it. And then on the side, we also have a regular handle so you can carry the bag like a suitcase. Now, basically it comes with 3 pockets. In this front pocket here, we store our medicines. And the medicines, there are 4 pouches, and they used to be in an orange bag, but the pouches have now been decanted into this bag. So, we're not going to go through the medicines today, that would be for another video. But just to make sure that you're aware, this front pocket will not be sealed because you must, as you're aware, on a daily basis, check the 4 medicines pouches to ensure that the seals are intact and that the bag or the pouch is in date. You may have noticed when I pulled this pouch out, this one has some various documentation attached. Our pharmacy department will attach documents to pouches if there's personal information for you to be able to use or need. Now, the oxygen sits in this purpose-built pocket here. You need to undo it first, obviously, because it's in there securely, and that will allow you to free your oxygen cylinder should you need it in a medical emergency. Now, a little bit later, we will go through the various masks, and I'll also show you how you operate the oxygen cylinder. Now, the main pocket opens up like a clamshell. And as you can see, there are 1, 2, 3, 4, 5 pouches within. Now each pouch is labelled with a title describing what the contents of that pouch will be, and the pouch is also colour coded. Okay, and we make reference to the colour coding on all documentation as well. You notice in the middle here we've got a file or an envelope that we can keep important information for you. Now the contents of this can change depending on what the trust deems appropriate, but what you will always find on here is basically a contents list for everything that's in the bag. So the pouches go pouch 1, 2, 3, 4 and 5, and we'll work our way through each one. So you can see that each pouch has a clear window so you can see contents. You'll also notice that each pouch has one of these security seals. The reason for that is that we need to ensure that the contents is fit for purpose and everything is available to you should you need it. So if you ever find a pouch with a seal that's broken, then that bag must come back to us to be refurnished for a new one. So pouch number 1, or the blue pouch. Now, just to highlight, you can take them out of the green bag if you so wish, or no if you don't want to. But this is what we consider our emergency pouch because the contents of it are items that you would need in both a cardiac arrest medical emergency and a medical emergency where a patient can breathe. So breaking off the seal. First of all, obviously we've got our AED or our defibrillator. Now, on a daily basis, again, as you're aware from previous equipment, the AED must be checked for two things. One, that there's a security seal, and you can actually see that through the window without opening the pouch. And the second thing you need to look at is, in this little window, there's a circle. If the circle's present, it means the defib is fit for purpose. If there was a cross in that window, it would mean that there's a problem with the machine and you will again need to send the entire bag back to us for refurbishment. So defib aside, just quickly showing you, but again you should be fully aware of this through training. Seal comes off, and inside a defib you've got the machine itself. You've got prep kit, again we talk about this in training, so that would be for removing clothing and prepping the skin. And then in the side here, at the back of the machine, this is how you can retrieve your electrodes to place onto the body. Okay. Now, we've got an extra couple of documents in here. This was going to be our initial reason, or initial place for putting documents, but now we have decided to put them here, so that's where you'll find them in the future. Okay, this pouch here is a very important pouch because it will provide you with the equipment that you need in any medical emergency initially. So when you open it up, first thing you'll find is some shears, obviously very important if we need to remove clothing quickly for examination, or if there's injury that we need to expose to assess. So we've got some cutters. Now, these are very similar to cutters that you may find in your ligature boxes. Your ligature box looks like this. Okay, again, we're not going to cover this in this training, but we will in another video. But the scissor primarily in your green bag is for you for removing of clothing. Now, if we have a medical emergency, quite often we find a patient has reduced oxygenation, so we need to supply oxygen. So in your primary pouch, you've got two ways of doing that. For someone who can breathe themselves, we've got the non-rebreathe mask. So this is the mask for people who can breathe, that we need to give oxygen as a supplement. Again, I'll show you this more in a minute. And then if we had a patient who we had diagnosed in cardiac arrest and we need to ventilate, then we have our pocket mask. This is a one-man ventilator, and this is the mask that we should use initially on commencing CPR with a patient. If we're using oxygen as a therapy, so again the patient's breathing, then we do provide you with a mini pulse oximeter. So as you're aware, this is a device that you can place on your finger, and it will tell us the person's oxygen level by percentage and also their pulse rate. This works on batteries, so there's only two items in the bag that it does, and we always provide extra batteries should you need it. We've got a pen torch, okay, very important if you're doing your A to E assessment for pupil responses. Also very handy if you're in a gloomy environment or you're assessing someone's, maybe their oral cavity. This makes it a lot easier for assessment when you've got some illumination. Now, in this packet, we've got what we call a McGill's forceps. And simply put, in a medical emergency, if we have a patient with a partial occlusion to airway, maybe there's something in their mouth that we need to relieve, this is a perfect tool for removing things out of oral cavities. Okay? Best practice is use this with your torch so you can see what you're doing. So in this initial pouch, we have a means of oxygenating someone, both in being unwell or if they're in cardiac arrest. We have the means of assessing and looking in airways and maybe removing things. We have a means of assessing oxygen therapy, and then some scissors if required. So this is the reason this pouch is in pouch A with the defib, because it's usually, if in an emergency, we expect that pouch to be opened because you will be using stuff from within. From here on now, every other pouch in the bag will have specific purposes, but we'll obviously explain in this one. So, just below the defib, we've got pouch number 2, and inside it holds the bag valve mask. It comes in an outer packet, which is just hard plastic for protection. Inside, it comes in a sterile bag. Now, the bag valve mask is a ventilator for someone in cardiac arrest, and it's a 2-man ventilator. So that's the reason in pouch number 1 we have the pocket mask, because that's a 1-person ventilator. Now, the bag valve mask would be used by people who have been trained to use it. Okay, so everyone at basic life support level knows how to use a pocket mask. Bag valve mask ventilation is taught in medical emergency, or if you've got external training from ILS or ALS from the Resusc Council. Historically, in our old bag, because the bag valve mask was just sat in the bag at the top, people used to grab it and open it, and they were basically grabbing a piece of equipment they weren't necessarily trained in. So this is why we made a decision in this bag that we've separated the bag valve mask, and it's only for people that are trained to use it should open up pouch 2 in cardiac arrest. So in that pouch, with the bag valve mask, you've got 2 other masks, different sizes, just to ensure that we get a good seal on the face. And last but not least, in the external bag, we have a syringe, a 20ml syringe. Now, these masks have air inside, and sometimes with compression, the air gets released. And if you haven't got air in this mask, it doesn't seal on the face properly. So this is why you have this small little port here. It allows us to put more air into the balloon if required, if it's a little bit flat. Now, just for patient safety, this is a non-sterile syringe, and we've labelled it clearly so that people don't accidentally use it for drawing up medicines. And inside this little bag, you've also got a very brief few sentences, just an instruction telling you what this is for and how to inflate your bag if you need it. Again, at the end, I'll spend a couple of minutes showing you how to use this. So moving on to pouch 3, again, security sealed. Now this pouch is everything that you might need to help you manage a patient's airway. A person who's conscious can manage their own airway, okay? But someone who has become unconscious, they lose muscle tone, and subsequently airways become partially obstructed. So we may have to assist and promote a better airway so we can ensure adequate ventilation. So in pouch 1 you saw that we had the McGill's forceps, okay? That would deal with solids, but we've now also got this. And it's a suction device which we can use to remove liquids from someone's orifice. So within its bag you'll find 2 other items. This is known as a Yanker sucker, but basically it's just a straw. And you attach that to the front. And now, by pulling the handle, it creates suction, which would allow you to drain someone's oral cavity quickly in an emergency. The last thing that's in the bag is a small cap. Now, basically, it's provided in case maybe a doctor decided that they wanted to take a sample of someone's secretions. So if that was the case, or if you needed to empty the bottle, what you do next is always the same thing. Take 2 fingers, cover the top, and pull the bottle off. So if we were emptying this because it's full, unscrew, get rid of the contents safely, put the lid back on, attach, and we're ready to go. And if the doctor had asked for a sample of said secretions, then remove the bottle, remove the top, and this time, keeping the contents, take your cap, attach, and then we can label the bottle and send it off for analysis. So other things that we find in pouch number 3, we have simple airway adjuncts. These are simple tubes. These type go into the mouth and these type go up the nose, but basically they're simple tubes to help promote a better airway for the patient. These need to be measured prior to putting it in your patient, and again we teach how to do these measurements in medical emergency training, so we won't cover that here. But simply put, depending on someone's level of consciousness will dictate what tube you may use, and hence we provide both. And last but not least, we have some KY jelly, or some lubricating jelly, and they're used so you can insert the nasal tubes in safely. Okay, so we provide that. Okay, moving on to pouch number 4, which is also green. Break off the seal. Now, within this pouch, we've basically got some extra equipment, things that you may need in an emergency that we've just all grouped together. So we have a blood pressure machine, a little mobile one, it's an electronic one. Again, this runs on batteries, so there are always spare batteries inside should you need it. Now, just so you're aware, we always check the batteries when bags come back to physical health team for refurbishment. So we can guarantee that your battery should be fit for purpose, but if there is ever a problem, rest assured we've got some extra. We have got a sharp spin because we have the means of drawing up medicines or cannulating a patient, so putting a specialised needle into someone's arm if we need to give fluids or medicines. So obviously a sharp spin for safety. We've got a stethoscope, again listening to heart, lungs and bowels, primarily used by the doctors, but some nurses may be trained to use this. Now we have a peak flow meter. Now, this basically assesses a patient's breathing ability, okay? And it's actually used in conjunction with the documents that I've mentioned earlier. So this is a peak flow chart, and it's attached to a medicine pouch. So this medicine pouch here is C, it's for breathing, okay? So that's always a good way, or a quick way of finding out which pouch you need for breathing. It's always got this document attached. But you have a means of assessing someone's breathing ability. You can compare it on the peak flow chart to what they should be able to do, and then the second document will give the doctors some indication of maybe the type of medicine and dosage to give to help the patient in breathing difficulty. So this is primarily a diagnostic tool, but we would use or need to use it in an exacerbation of asthma type situation. And last but not least, in that last pouch, we simply have a space blanket. We may be dealing with a casualty outside of the ward environment, maybe in the garden, so again, something just to keep people warm. And we're down to our last pouch now, and this last pouch has lots of stuff in it, so I will remove it. Now this pouch is primarily for the doctors. And it contains stuff that we would use for cannulating a patient if we need to give fluids or medicines intravenously. But it also has a few other pieces of equipment that would be pertinent when you're using sharps. So, first of all, we have some personal protection. So you've got some gloves, some apron and some eyewear. Something to wear in case there's bodily fluids present, or if you're drawing up medicines, to do so safely. We have the cannulas. Now, cannulas come in 4 sizes, as you've been taught in your medical emergency training. The bigger the cannula that we can put in a patient, the quicker we can give medicines. But admittedly, the bigger the cannula, sometimes harder it is to get in. So the medics have a choice of 4 different sizes in here that they can choose. But to put a cannula into someone's vein, you also need to prep. So we provide you some prep kit. So first of all, we have some alcohol wipes for cleaning the skin. We've got tourniquets for tying around the arm to plump up veins to help with insertion. Once a cannula is in, we've got some dressings to hold it in place. And sometimes, maybe with a failed cannulation or if there's a little bit of oozing, we've got some gauze for cleaning up. In the medicine pouches, we have lots of different medicines that quite often need to be drawn up or processed prior to administration. So we provide various size syringes and green needles for drawing up medicines. Green needles are in the bag specifically because they're good for drawing up, but they're also your primary size needle for intramuscular injections. And then finally, we've got a couple of giving sets. Giving sets could be used if we had to administer giving sets. And they're used to connect your IV fluids to a patient. So we provide two types of fluids. We have normal saline to improve blood pressures, and we also have 10% glucose IV, which we would use for low blood sugars. Okay, so before we finish, let's talk a little bit about your oxygen. So first of all, this round cover has to come off, otherwise this bottle with this oxygen cannot be used. So by pulling that cover off, it shows you or reveals the actual on switch, which is a black valve. Now it's turned anti-clockwise, okay, to open the valve. And you hear a pop. Now, the mistake a lot of staff make is they keep turning this round valve. You do not need to. As soon as you hear that pop, it's a quarter turn, it's ready to go. Under the handle, there's another grey cover. When you take this down, you can see you've got two connectors. We always and only use the top one, the silver one, which is called a fir tree connector. To actually set the flow rate, there's a white valve at the very top with a small window in it. Now, the bottle is not running at the moment, it's on 0, but when you turn this white valve, you can hear or you can feel gas flow. Now, we have, as I've shown, 3 masks available in our bag. So we'll talk about the one that we use on a person who can breathe first, because this is usually the mask we use the most. When you take it out of this bag, it's really important that you check that basically these 2 yellow round seals are attached to the mask. Sometimes one can fall off. Okay? If that's happened, I can guarantee it will be found in the bag. Now they're very simple to put back on. Just basically, there's a small little spike and you just attach the seal to that spike and it will cling back on. There's also a valve on the inside. This one never falls off. It's only the ones on the outside that can potentially do so. So watch what happens when I attach it to oxygen. So I've plugged it in and I've turned the gas on full, 15 litres, which is what this runs at. Now, if I put it on my face now and try to breathe, I don't get gas. It's very important, you must take your gloved thumb, cover that central valve, and it forces the bag to fill up. Now, I can breathe. Okay, so doing that to this non-rebreathe mask is imperative before you put it on the patient, and we call it priming the mask prior to oxygen delivery. If you're using this mask on someone who's having oxygen therapy, remember we must use pulse oximetry to ensure that the person's getting enough oxygen and also to tell us when to stop. So that's called a non-rebreathe mask, and that's for people that can breathe. this is a patient, we've diagnosed cardiac arrest, and we're about to administer rescue breaths. Now, you can do mouth to mouth, but best practice is for us to use a pocket mask. When you take it out of your bag, it's sealed in a box. Open up your box. Now, your mask is not fit for purpose until you do this. Turn it into a dome. Now, you can work, if you're on your own, from the side. Now, to work from the side, make your hand into this shape. Place your hand on the mask, open the airway. And you blow gently, watching the chest rise. Now, on the wards, you'll appreciate we'll have more rescuers, so eventually we save the sides for equipment and for compression, and we do breathing over the top. So to use a mask from above, change your grip to thumbs, place thumbs on the mask, open the airway, and you can continue to breathe from above. Now, when you use a mask and you're breathing, the patient gets 17% oxygen. But if you attach it to the oxygen cylinder, we can increase the oxygen percentage up to 50%. The problem is, this doesn't come with a tube. Now, if you went to the other ventilator, you will find that its tubing is glued on, you can't use it. So you need to think outside the box. You go to the mask that you shouldn't use in cardiac arrest because its tubing comes off. You attach it to this port. Attach the other to your cylinder. Again, turn it to 15 litres per minute. Now, at the moment, gas is escaping because he's not breathing, but every time I ventilate, he gets my breath, but he gets oxygen from the cylinder. Now, on the wards, when we have different disciplines with people with different levels of training, you will have people arrive that have done medical emergency training with us, or they have ILS certification from the Resusc Council. And they are the ones that are trained to use this device. So when it's taken out of its sterile bag, as I did earlier, the first thing you must do to it is this. By putting it into a football shape, it increases the volume within, so you have more oxygen going to the patient. Now, as you can see, my mask fell off, and that's because masks are detachable, because remember, we have other sizes in the bag. Now, I will demonstrate this, but remember, you use this if you're trained to do so. So attach it to oxygen, turn it to 15 litres. Now, as I alluded to earlier, this is a two-man job. So my role at the head is to hold the mask using my thumbs, and my job is to maintain an airway. My colleague's job, imagine someone's doing compressions at the side. When it's time for compressions, they would squeeze the bag thus. And then they would start compressions again. So this requires two people to work the mask safely. Okay, thank you very much for watching this video. It's important that you do have a means of looking at the contents of the bags more often than we can in just training. So we would like you to make sure you refresh yourself at least annually with the video. If you feel that you've forgotten or you're feeling unconfident, again, the video is available to you whenever you want to look at it. You can either go to the Physical Health Hub page and Insight, or it will also be on YouTube if you want to access it that way. Best practice when you have new colleagues coming into your wards or into your teams, do make sure that they also have access to the video, so that if we do have a medical emergency on the wards, bringing the bag and the utilisation of contents is done in a confident and safe manner. Okay, thank you very much for watching the video.